Hello everyone, my name is Grainne O'Leary and I'm Chief Executive in Arthritis Ireland. You're very welcome to our session on COVID-19 and arthritis. And I'm joined today by Dr. Richard Conway, who's a consultant rheumatologist in St. James's Hospital in Dublin. You're very welcome, Richard, and thank you very much for joining us.
I'm delighted to be here. Thank you very much for the invitation.
Okay. So the first thing I'm going to start off is just starting at the global level of things and asking you a little bit about the Global Rheumatology Alliance. Can you tell us a little bit about what that is?
So the Global Rheumatology Alliance is a collaborative group of physicians and patients. It developed quite quickly after the onset of the COVID-19 pandemic, originally on Twitter, among people who are using that platform. And with the aim of gathering data on patients with rheumatic diseases who developed COVID-19 and looking at the outcomes in that to try and improve the overall care of patients.
Okay. And I suppose from the Irish perspective, who's involved in the Global Rheumatology Alliance?
So I'm the physician national lead for Ireland and I sit on the clinical and scientific committee of the Global Rheumatology Alliance, or the GRA. And then Wendy Costello is one of the patient representative leaders in the GRA, and she sits on the steering committee of the GRA. And at a deeper level, everybody who participates in the GRA is part of it. So all of the physicians and the patients who enter data into the registries.
Okay, thank you. And I suppose one of the things at the start of the pandemic was, I suppose, the absence of data relating to COVID-19, related to people living with arthritis. What sort of data is now being collected?
So there are two separate data registries as part of the GRA. There's a physician-entered data registry and a patient-entered data registry, and they collect two different types of information, really. So in the physician-entered registry, physicians enter information about cases of inflammatory rheumatic disease who develop COVID-19 and quite detailed information about their disease, its treatments, and the course of the COVID-19 infection in those patients. And then the patient-entered registry collects information from patients with rheumatic diseases, and it collects information whether or not people have had COVID-19 around their disease and its treatments and how that's changed during the pandemic.
Okay, so there may be patients, watching the session, who would like to participate in that. Can you tell us a little bit about how they can participate and, what happens to the information that they might provide?
Yeah, it'd be absolutely fantastic if people want to participate. There are more than 13,000 patients have already participated in that at a global level. If people do want to participate, it's quite simple. You just need to go on to the website of the Global Rheumatology Alliance. And once you go there is quite clearly signposted how to enter the information. You click on a link, it brings you to a survey which is fully anonymized, and all of the data entry is quite simple from there. And then that anonymous data is combined with other patients and is analysed at a global level.
Okay. What have been some of the key findings from the work so far?
So it's a work in progress. We probably have more data has come out of the physician registry to date. Obviously, at the start of the pandemic, we were all very concerned about the potential impact of COVID-19 on patients with rheumatic diseases. And I think a lot of the data has been very reassuring regarding that. What has come out of it is that the risk factors for people with rheumatic diseases seem to be quite similar to the general population. So age and non-rheumatic disease comorbidities being the biggest risk factors. And then we have quite reassuring data around a lot of our medications, and that they, in fact, do not seem to be risk factors for developing more severe outcomes with COVID-19.
Okay. So you mentioned there about, treatments and, various treatments used for the treatment of inflammatory arthritis have been mentioned, in connection with treatment for COVID-19. What have the findings been of the Global Rheumatology Alliance? Have they shown anything in relation to this?
Yeah, so we have to be a little bit cautious interpreting that data because it is a case-based registry, so it's open to bias in its findings. I suppose the big hope in the early stages of the pandemic was that hydroxychloroquine would be an effective treatment for COVID-19, and that hasn't really been borne out in studies after that. And has the data from the Global Rheumatology Alliance would be consistent with that. It didn't seem to have any impact either positively or negatively on outcomes. And similar effects for most of the traditional disease-modifying drugs, that they seem to have a neutral effect. And then when we come on to the biologic agents, which would probably been what we've been most worried about in early days of the pandemic, they certainly don't seem to have a negative effect, and there is some suggestions that they may potentially be beneficial rather than harmful. And then in terms of agents which do have a negative effect, the one we would have expected, high-dose steroids, certainly do seem to be problematic.
Okay, thank you. And I suppose moving from the global perspective there back to Ireland, and I suppose we're at a particular juncture now in Ireland where numbers of cases are rising. We're in the autumn, we're heading towards the winter. We know what the winter can bring in terms of difficulties with flu, etc. What is your advice to people now who are in that highly vulnerable cohort?
So I suppose the key is identifying the people who are actually highly vulnerable. And the starting point of that is if there's something else that makes you highly vulnerable, such as age or some other condition, then to treat yourself as highly vulnerable. Some of the people we would potentially have considered as being vulnerable purely because they had a rheumatic disease to start off with in the early days of the pandemic are possibly not as highly vulnerable as we thought. So that merely having a rheumatic disease or being even on a biologic treatment probably doesn't put you into that category. Having said that, if you are in the highly vulnerable category, then especially with the cases beginning to rise again in Ireland, I think it would be prudent to exercise as much caution as possible and to limit interactions with other people as much as possible, especially in indoor spaces, and to keep doing the simple things well. So to wear a face covering, to wash your hands, and again to limit interactions with others. Okay.
Are those on immunosuppressive therapy going to be at greater risk, indefinitely, or can you just tell us a little bit more about that? Because that's one of the key areas that people have been really concerned about.
Yeah, I think there's data is constantly emerging and changing to some extent in this, and we have also been very concerned about potential risks of these medications. I think the risk is going to be the risk, at least until we get a vaccine. But a lot of the data has been quite reassuring regarding most of our medications, and that they're not actually making people more vulnerable than even if they weren't on them. There are a few medications we continue to have concerns about. So medium to high dose steroids in prednisolone of 10 milligrams a day or more for a prolonged period. So that would be for weeks or months on that dose, not people who are using it for short courses to settle a disease flare.
Yeah, okay.
That probably wouldn't put people more at risk. People on our disease-modifying drugs, including our biologic agents, we would not consider to be at particularly increased risk by virtue of being on those medications of getting more severe COVID-19. Okay. And then a few of our less commonly used medications, such as cyclophosphamide and perhaps rituximab, may be a greater risk, but we don't have very good data around them to date. So we continue to advise being cautious if you're receiving those medications.
Okay. And just to people out there who maybe have recently had a diagnosis of inflammatory arthritis, or who are perhaps have been advised to switch to or to start a new therapy, that question of should I start immunosuppressive therapy at this stage, during a pandemic, it's a question we've often been asked. And what would your view on that be?
So I think things have probably changed from the first wave, when we knew there was going to be, or we hoped, I suppose, that there was going to be a short, very hard hit, and then things were going to settle down again, which is what transpired, thankfully. People were deferring starting treatments at that stage. I think at this point we're into a longer game in terms of the pandemic, and things are going, unfortunately, to continue in a similar vein to how they are now, I think, for quite a while. And I think, given the relative safety of most of our medications, and the significant harm that can occur from delaying those in terms of both suffering with symptoms and potential damage to joints, I would recommend that we go ahead and start those medications now, that they wouldn't be delayed any longer. And that would include the rare instances when some of those higher risk medications are recommended. I think if a disease is severe enough that the physician is recommending those medications, such as high dose steroids, then they probably do need to be started now.
Okay, thanks for that. So there's been quite a bit of publicity and discussion around telemedicine. How are teleclinics working for you as a consultant and seeing your patients?
So I suppose, thankfully, we have largely been able to restart face-to-face clinics. So that has been good. We've been able to see people in the traditional way. Telemedicine was a challenge for everyone. I think we weren't used to it. It had not been used very much in Ireland before the pandemic, so we were kind of, both from a physician and patient side, thrown into it in a very unprepared fashion. I think while it was an essential experience, it has largely been a frustrating one from both sides. I found it very difficult to properly assess somebody in the telehealth setting. We've also had difficulties getting video telehealth set up properly, so it's largely been phone-based. So I think for some people it can work well, especially if things are going well and their disease is stable, their treatments aren't changing. But if there is any issue with that not being the case, so if the disease is flaring, we need to change treatments, I haven't become very comfortable using telehealth to do that.
Okay. And have you had any feedback from your patients around their experience?
I have, and I think, again, most of my patients have found it similarly frustrating in the situation where something needs to be changed. I think for somebody on stable treatment who's getting a more routine review, that has worked well over telehealth. But for anything where we had a clinical decision to make between us and a discussion to be had, I don't think it's been very satisfactory for the patients either.
Okay. Now, just an issue on sort of employment, and many people with arthritis, with other rheumatic conditions, are in employment. They're going to the workplace. How should those on immunosuppressive therapies disclose this to their employers to ensure their safety? So certainly one of the questions that's come up for us is around people who are working, and I suppose that risk of returning to the workplace during COVID-19.
Yeah, so there are a lot of different aspects to that, and to some extent, if the general advice from the government is if remote working is possible, it should be done, and I think that should apply to people with rheumatic diseases as well. The lowest risk of developing COVID-19 is if you're not interacting unnecessarily with other people. And perhaps from some quarters there has been a tendency for people to go back to work when in a face-to-face setting when it may not have been necessary. So I would again agree that should be limited as much as possible. I think people with rheumatic diseases, as we talked about earlier, may not necessarily be at higher risk, many of those patients. And in that setting, they may not even need to tell their employer, provided the workplace is otherwise set up properly. If they have any concerns about that, then by all means they can talk to their employer, but it probably would help for them as well that there was something from their physicians to support that, and we'd be more than happy to give any information that was needed to their employers to facilitate safer working.
Yeah, okay, thank you. Now, in terms of the longer term consequences, we know the COVID-19 now, we understand it is here to stay for the foreseeable future. What are the long term consequences of those who have contracted COVID-19? Is anything known about that?
Yeah, so simply put, we don't know what the long term consequences are. It seems that some people with COVID-19 recover completely in relatively short time frame. Then there seem to be another group that do recover completely but take longer. They have kind of persistent symptoms for weeks or even months that then subsequently resolve. But there also seem to be a group, and we're not really sure how many people are in that group, who develop longer lasting symptoms that may not resolve after the COVID-19 infection, whether that be from organ damage that's happened at the time of the infection or for some other factor we're not clear about yet. And I think that again drives home that prevention is the best thing. Not getting COVID-19 is what's going to reduce that risk as much as possible. And that seems to be the case not just in vulnerable groups but also in younger people who may have milder infection. So another reason to emphasise the need for those people to take proper precautions around developing COVID.
Okay, thanks. And I presume that's something that the Global Rheumatology Alliance will be following as well in terms of the long-term.
Absolutely, yeah. There will be follow-up of those cases to see what the outcomes are. And again, we don't know if the outcomes for people with rheumatic disease will be different to the general population. We hope and suspect they may not be. They may be similar, but only as the data emerges and time passes will we know that for sure.
Okay, thanks. So linked to that, in Arthritis Ireland, we conducted a survey of people living with arthritis over the summer months, and we've just released the findings of that survey of just over 1,100 people living with various types of arthritis and rheumatic disease. And one of the findings of our survey was that people with arthritis is that almost half of the respondents, so 45%, were doing less exercise during lockdown than they would ordinarily be doing. What would you say to people with arthritis about physical activity? And have you any suggestions on how they can keep active, during this extraordinary time that we're living through?
So I think exercise is really important for everyone, for both their general physical and mental health. And particularly for people with arthritis, it's very important for people who exercise generally have better disease control, and also for limiting the side effects of some of the medications that we use, especially things like steroids, that exercise can limit the negative consequences of those essential medications. And I think it has been a very challenging time for everyone in terms of exercise, and life has been turned upside down, and it's so different that our normal routines have often fallen by the wayside. But very important, especially as time has passed, and we seem to be in this for the long haul, that people do their best to get back to exercising in some fashion. I think there are lots of different opportunities out there. It seems that our traditional kind of face-to-face class-based initiatives aren't going to be possible to a large extent. And so we'll have to find alternatives, whether that's exercising on an individual basis, or there are a lot of very good resources out there online, many of which have only started since the pandemic, with online classes and exercise programs.
Okay. Another finding in our survey was that 2 in 3 people felt more anxious during lockdown than they normally would. What can people do to keep mentally well during this pandemic?
So I think it's a very difficult area, and I think that is probably true of the general population as well. People are very, very anxious, and to an almost pathological state sometimes, that people have really, really heightened anxiety around COVID. A lot of which is understandable. COVID is a really nasty infection and can cause a lot of harm and kill people. But I think anxiety for its own sake is not necessarily helpful, so we need to limit that as much as possible. I think exercise does help. So again, exercise helps mental health and helps reduce anxiety. I personally have found that paying too much attention to all of the news and all of the numbers is not necessarily helpful, and that can lead to heightened anxiety. So I think certainly personally, and perhaps some other people, it can be good to switch off for a while and not be constantly focusing in the news throughout the day. And I think some of the data coming out about the fact that the risk may not be as increased for particular people will also help reduce some of that anxiety.
Yeah. Okay. Thank you. I suppose there were our questions for you today, and thank you very much for coming along. I think people will really gain a lot of benefit from the information that's been provided today. So thank you very much for coming, Richard.
Well, thank you very much for having me.
Thank you. Remember too that if you would like more information on COVID-19, please refer first of all to the HSE website, hse.ie. You will find all of the most up-to-date information there, as well as useful resources that can help you at this time. Also look at our website, www.arthritisireland.ie, for all updated information on COVID-19 and arthritis. If you have any questions or concerns, please do know that we are here for you, and you can call us on our helpline, which is 01 6618 188, or on 1890 252 846. Thank you very much for joining us, and thank you to Richard for his insights and information that he shared with us today, and we look forward to seeing you again soon.